Most people think they suddenly get old in their 60s and 70s. I don't believe that's what's happening at all. I believe the body slowly adapts to decades of gravity, injury, poor posture, muscle imbalance, and structural stress, until one day the decline becomes painfully obvious. And by then, many people have aged physically long before they've aged chronologically. Hi, I'm Dr. William Pierce. I'm a chiropractor, a board-certified non-surgical orthopedist. I'm a sports injury specialist and also a peptide researcher. Over the past 42 years that I've been in practice, I've had the privilege of working with over 30,000 patients through 300,000 one-on-one patient visits. And one thing became very clear to me over all those decades. The human body is not just biochemical, it's biomechanical. And if the structure of the body begins to deteriorate, then quality of life often deteriorates with it. But first, a medical disclaimer. This video is for information purposes only. It does not constitute medical advice. I am a doctor, but I'm not your doctor, and no doctor-patient relationship exists between the two of us. Always consult your own qualified healthcare professional before making any decisions about your health. Do not rely solely on online information for diagnosis and treatment. Every second of every day, your body is fighting gravity. That sounds simple, doesn't it? But it's really profound. From the moment you stand upright as a child, your muscles, joints, discs, ligaments, tendons, and nervous system begin adapting to the physical stresses of life. And over decades, those stresses accumulate and create tiny compensation patterns, which can become permanent. Old injuries alter movement. Weak muscles stop supporting joints properly. Mobility decreases, posture changes, and gradually the body begins to break down. Think about what we commonly see as people age. The head begins drifting forward. The shoulders round inward. The upper back curves. Hips tighten. Walking shortens. Balance worsens. People lose height. They become stiff getting out of chairs. They stop rotating properly. Breathing even becomes more shallow. Most people accept this as unavoidable aging, but in many cases, what we're actually witnessing is decades of structural adaptation. And today, modern life is accelerating this problem as we spend hours looking at phones, sitting at desks, driving, watching screens, becoming less mobile. What we now call text neck really is forward posture, and that dramatically increases stress on the cervical spine and the upper back. The farther the head moves forward, the greater the mechanical load placed on the muscles, joints, discs, and nerves in the neck. And over years, the body adapts to that stress pattern. One of the most important things I've learned in clinical practice is this: the body always compensates if one area becomes weak, restricted, injured, or unstable. Then another area takes over. And that compensation may work temporarily for a while, but over years, it often creates asymmetry, imbalance, degeneration, chronic pain patterns. A bad knee changes gait mechanics. A foot problem alters hip function. A shoulder injury changes spinal rotation. A spinal imbalance affects movement throughout the entire body. The body is deeply interconnected. And this is why I believe posture and structure belong in every longevity conversation. Because longevity is not simply about maintaining function within those years. Can you walk confidently? Can you travel? Can you play golf? Can you lift your grandchildren? Can you get up off the floor safely? Can you remain independent? Those are the structures that are profoundly important for us as we get older. Now, let me be clear. I'm not talking about perfect posture. None of us is perfectly balanced. None of us escape aging. And all of us accumulate injuries and compensation patterns over time. The goal is not perfection. The goal is awareness, preservation, maintenance, movement, and adaptation. I believe after 50 especially, people should begin asking different questions. How well am I moving? How balanced is my body? Am I becoming stiffer every day, every year? Has my posture changed? Am I losing mobility? Am I compensating around old injuries? Am I maintaining strength? Those questions matter. In the next video, I want to take this one step further because structure is only part of the story. Behind posture, balance, movement, coordination, pain adaptation, and body awareness. There's something much more important. the nervous system. And I believe understanding the neurological side of aging may completely change the way you think about health and longevity. Remember, I'm Dr. Bill Pierce. Longevity is not just about living longer, it's about remaining upright, functional, mobile, capable, and engaged with life for as long as you possibly can. Stay with me during the journey.